The Purple Butterfly approach is how we deliver individualised, compassionate end-of-life care in a busy acute hospital. We care for more than 1,800 patients a year at the end of their lives in MBT, so it's part of all of our daily work. There are roles for all members of the team in delivering good end-of-life care, and this video aims to give you an introduction to all of the different components that make it work. Making the decision that a person is dying and that the focus of care should shift to comfort and dignity should be a team decision, but must be endorsed by the consultant caring for the patient after discussion with the patient if possible and with their loved ones. If the decision is taken out of hours, it must be endorsed by the most senior member of the team, but countersigned by the consultant at the earliest opportunity. The consultant must start the process by signing the sticker. The nurse looking after the patient will take 3 key steps. Step 1, they will place a purple butterfly sign on the door of the patient's room. They will only put this up once the patient, if possible, and the family are aware of what it means. This gives messages to many members of the wider team, as well as preserving privacy and dignity for the patient. Once the purple butterfly sign is on the door of the patient's room, the nurse will add the icon so that it is visible on flow. Step 2. The nurse will complete the nursing team initial assessment and place it in the end of bed folder. This will ensure that all aspects of good end-of-life care are covered, such as ensuring that we understand patients' priorities and preferences for care, that we ensure that their spiritual, cultural and religious needs are met, and that we have accurate contact details for their loved ones. Once this has been completed, the nurse will talk to the ward housekeeper about offering the patient more appropriate food via the Purple Butterfly menu, and also that we are caring for their carers by offering them a carer's badge and concessions for parking. Step 3, the symptom observation chart. The nurse will replace the news observation chart with the red, amber, green symptom observation chart. The nurse will explain to the patient and their carers that they will ask about and assess for symptoms every hour. They will check for pain, shortness of breath, distress and agitation, nausea and vomiting, condition of mouth, and respiratory secretions. If symptoms are absent, they will sign in the green zone. If symptoms are present, they will decide whether they are moderate, amber, or severe, red, and give PRM medication accordingly and reassess. It is vitally important that the nurses escalate to the ward doctor in the day or to hospital at night if for 2 consecutive hours there are symptoms that score in the red or amber zone, so that the patient is reassessed and their symptoms are addressed promptly. When starting to use the Purple Butterfly approach, there are 3 key steps that the medical team must do to start the process. You will find everything in the top drawer of the Purple Butterfly trolley in the clinical area on each ward. Step 1. Take the signed sticker and place it in the clinical notes after the last entry to start the process. Step 2. Take the medical team assessment sheet and complete side 1, which guides you in the principles of good end-of-life care, such as what are the priorities for the patient, rationalising the medications, stopping unnecessary interventions, making a plan for nutrition and hydration, making sure that anticipatory prescribing is done to address any symptom control needs that the patient may have. Turn the sheet over and complete the initial plan on side 2. This guides the staff in how to care for the patient now. Give a plan for whether you want to continue with oxygen, blood glucose monitoring, fluids. Does the patient need a syringe pump? Do they have uncontrolled symptoms? Having completed the paperwork and made an initial plan, talk to the rest of the team. Find the ward pharmacist and ensure that the purple dot sticker is on the drug chart. This helps the pharmacist in checking that they have appropriate drug stocks for this patient available should it be needed. Share all the plans with the nurse looking after the patient and make sure that a handover goes to the most senior nurse running the shift so that this is included in the safety briefing at the change of shift. Step 3. Take the ongoing review sheets and use these to document any further ongoing assessments, reviews and conversations. Patients should be reviewed at least daily, ideally jointly with the doctor and the nurse looking after them. Assess the patient, ask after their comfort. If they are not able to respond, ask their loved ones and the nurses who have been caring for them. Look at the symptom observation chart and see if there have been any uncontrolled symptoms. Look at the drug chart and see how many PRNs have been used. Does the PRN use correlate with the red and amber scores on the symptom observation chart? Look at the back of the chart and see what action was taken. If several PRNs have been used, consider the use of a syringe pump. Also remember to update the family and offer support to them too. If you are concerned about uncontrolled symptoms, make a referral to the palliative care team via the ICE referral system. If you are looking after a patient and symptoms are uncontrolled for 2 or more consecutive hours, ask for help. In the working day, the nurse must escalate to the ward doctors, and the palliative care team are available Monday to Friday, 8:30 to 5 p.m. At night or weekends, escalate to the hospital at night team. If symptoms remain uncontrolled, the hospital at night will ask for advice from the medical SPR and or the palliative care consultant on call via switchboard. When someone dies, there are 4 key steps that must be taken. Firstly, after verification of the death by a suitably trained practitioner, the verification of death form must be completed for all deaths, regardless of whether the purple butterfly has been in use or not. Step 2, the nurses will contact the family and ensure that they have the When Someone Dies leaflet given to them, and they will give care after death to the deceased person within the ward. Step 3, the next working day, a member of the team, often the ward receptionist, will phone the GP to let them know of the death of their patient. Step 4, bereavement services will be in contact with the junior doctor who has been involved in care for the patient to complete the after-death paperwork, including the medical certificate of the cause of death. And an important part of the process is completion of the ICE notification of death, which can be found in the discharge section of ICE. This short video gives a broad overview of all of the processes. Please ensure that you orientate yourself in your clinical area and ensure that you are familiar with everything you need to know for your role, and also that you understand all the other team's roles. A toolkit illustrating all of these processes is available in the top drawer of all of the Purple Butterfly trolleys.